Pneumonia has been identified as the leading killer of children under the age of 5 years worldwide. This statistics is from the World Health Organization. Developing countries account for about 98% of these deaths globally. Sub-Saharan Africa records the largest cases of pneumonia, and Nigeria is in the lead.
In 2008, as much as 177,000 children were reported to have died from pneumonia. Nigeria actually has the second highest report of pneumonia deaths in children in the world, and number 1 in Africa.
Pediatricians say that pneumonia is an infectious disease.
Pneumonia is an infection of the breathing part of the lungs. The breathing part of the lungs. The lung has so many parts, but there is a part we call the breathing part. It is the infection of that place. And it is very, very important because that is the part that makes the body to make use of the oxygen in the air that we breathe. And when that part has infection, it means we cannot breathe very, very well.
It's caused by germs. The commonest of the germs that cause pneumonia are actually bacteria and viruses. But apart from these two, you can have fungal infections too, particularly in patients who probably have HIV or AIDS. And some chemicals can cause pneumonia. Oftentimes when children aspirate some chemicals, it could be from, I'm sure sometimes we hear things like children accidentally taking kerosene. It's something that happens where people mistakenly put things in wrong containers. Children can aspirate chemicals and this can cause pneumonia.
In Nigeria, it is also the third leading killer of children. The situation is not different whether you're in the southern or eastern part of Nigeria, but it is even more in the northern part of the country because of the higher prevalence of undernutrition and malnutrition. So pneumonia is a significant cause of morbidity and mortality in this part of the country.
The predisposing factors of pneumonia are largely environmental.
The uppermost in environment has to do with overcrowding, a situation where people live in one room, and that one room you have 10 people. They live there, they sleep there, they cook inside that one room. It's very easy for children to acquire infection from adults or even other children because of how close everybody is packed together in that one room. So environment is very important. Still talking about environment, indoor pollution, a situation where people are cooking, where a lot of smoke is being produced. There is clean cooking in the house, and there is cooking where you're doing, and there's so much smoke inside the house. It's not healthy for young children. And then you find some people, adults, who smoke inside the house where you have small children. That's very unhealthy, and those children are at risk of developing pneumonia.
Certain disease conditions that produce certain factors in the body that will encourage the development of pneumonia. One important one is sickle cell anemia. Sickle cell anemia is a condition that is very, very common in our own environment. Of course, we are all aware of the HIV infection, which is all over the places. It's also a big factor that will lead to pneumonia. Others will include measles. Measles itself can be a factor in causing pneumonia. Of course, there are minor factors like some abnormality in the breathing passages that somebody brings even from wherever the person is coming from. Can I say heaven? From heaven, which we call congenital malformation.
The symptoms are also not too difficult to recognize.
Pneumonia has very many symptoms. These are the things which the mother or the father or the family members or the care provider may see in the child that will begin to tell us this may be pneumonia. One of them is fever, hotness of the body. The child may suddenly develop hotness of the body, and then we have a runny nose, and then that's a catarrh, and from there on there may be cough. And if this is allowed to continue, then difficulty in breathing or fast breathing may then occur. There are others. For instance, the child may refuse to feed or refuse to drink, especially when that pneumonia is allowed to be severe. The child will refuse to eat. In addition to that, the child may become restless. And restlessness, irritability, just uncomfortable, and begins to feel very anxious and what we call irritable, all right, in the child. These ones are actually due to the fact that oxygen, that is in the air that we breathe, is not getting to where it is supposed to get to.
The children would usually be hot and then cough. Pneumonia often comes with cough, and then the breathing goes fast. Most parents would know how their children breathe normally, and so once their children are breathing faster than usual, in addition the child has fever and the child is coughing, that could be an indication that that child has pneumonia. Or the child could actually not just be breathing fast, but is having difficulty in breathing. How can you know that a child has difficulty in breathing? One, if you look at the nostrils of the child, if you look at the person who doesn't have difficulty, you won't see the nostrils moving in and out. But if a child has difficulty in breathing and you watch the nostrils, you're going to notice it moving in and out, in and out. That will tell you that this child is struggling. Again, if you lift up the blouse or the top that the child is wearing and watch the skin of the child, you would notice that the skin in between the ribs are going in and out, in and out. Sometimes below the bones, you find that the skin is going in and out. That shouldn't be. So if you notice your child is breathing and you observe this in the body of the child, that tells you that this child is struggling and that child requires immediate attention.
Sufiat Ali is a few months over 1 year old. She is one of the numerous children suffering from pneumonia in Nigeria. Her infection started not too long after her birth, so says her mother.
Okay, I gave birth to her on the 14th of August 2010 at the General Hospital. And about 4 or 5 months, she started having this recurrent fever.
Bilkis Ali, being ignorant of the disease, did not have any premonition of danger. Just like a child her age, Bilkis thought her daughter was suffering from malaria. After days of malaria treatment and no respite, Sufiat was eventually taken to the health center in Surulere, Lagos, where she was born. Sufiat was treated and discharged.
She was having fever and I was taking her to the hospital to complain, and they usually give us maybe malaria medicine and antibiotics to take home.
Her condition persisted, prompting her mother to take her back to the health center. It was at the second visit to the health center that a proper diagnosis was made, and Sufiat was then referred to a teaching hospital.
She started having temperature again and went back to that hospital, and she was having difficulty with breathing as at that time. So when we got to the hospital, that was when they said, oh, this thing was actually too much for them because the baby wasn't breathing well and they would not be able to handle it any longer. And they referred us to a teaching hospital. So that was how I rushed down to the teaching hospital that same afternoon.
1-year-old Sufiat was diagnosed as suffering from pneumonia. that was when the trauma for her and her mother began.
When the cardiothoracic people came that Monday morning, they checked her and said, oh, this is an emergency case, that this is a case of pneumonia. And it's as if it's even a complicated pneumonia. Maybe the thing has stayed long there or something, they don't know. That they have to quickly insert a chest tube into the left lung to be able to remove the fluid from the lung so that she will be able to breathe freely and use the left lung properly. So they inserted the tube that same night. They inserted the tube on the left lung, and the tube was actually draining fluid. It was draining fluid, and the tube was actually in her for like 2 weeks.
Following the draining of the fluid from her lungs, she was again discharged. Sofiat was, however, to go back to the hospital soon after.
Towards the middle of the following week, she started having this fever again, the normal fever that she has been having before we went for the chest tube and everything. So we had to go back to the hospital again.
That was when the complication of her condition was established.
We came for clinic day that Friday, and we saw them. They referred us to where they'll be able to take the x-ray again. And they did an x-ray on her and everything. So they saw it again and said, this one is not fluid now. This time around, it is now air space. They said they need to reinsert the chest tube again to remove the air space from her left lung again. We were even, initially when they said they wanted to reinsert the second chest tube, my husband and I objected immediately. This thing was going to be too much for this child now. This one, they said that was the only thing they could do. So they first did tapping with injection. They said that one wasn't enough. They had to reinsert the chest tube. So they reinserted the chest tube again.
To save her other lung and probably her heart, Sofiat has to undergo an emergency surgical operation. Complication from pneumonia, like Sofiat's case, arises from late diagnosis and poor treatment.
There are many complications of pneumonia. One of the most important complications that doctors will recognize is heart failure. These children's heart will be failing and will not be able to walk properly. But it is the doctor that will be able to tell the mother that this is what has happened. But it's a common complication of pneumonia. The others, of course, are there may be accumulation of pus in the chest. You know, the one we call the lung, that is the breathing apparatus, is located in the chest. Part of it, pus will begin to just accumulate. Like a big pus, it can occur as a complication of pneumonia. In addition to that, air and pus can come together and also accumulate in the chest. These are very bad complications that we in fact would not like to occur.
Pneumonia is treatable. The safe way is to get medical attention early. Prevention, they say, is better than cure. Mothers, therefore, must know what to do to protect their children from pneumonia.
Once the mother notices simple symptoms, you should take the child to an appropriate area for treatment. And that's also why WHO has put up very simple signs or method or strategy for everybody, including mothers and the village health worker, to recognize pneumonia. It is to prevent these very serious complications.
When things get severe like this, the presentation goes beyond the basic 3 we mentioned earlier, and the child could actually turn blue because he can't have access to oxygen as he should. The tongue goes blue, the lips go blue. If you look at the hands, the nail beds, they're all turning blue. That's a bad sign. We said earlier that it is germs that cause this pneumonia. The truth is that those same germs that are causing the infection in the chest could actually get into the blood and travel to other places in the body. So you could actually have a full-blown infection in the whole blood system of that child. And sometimes these germs could actually travel to the brain, and something that started from the chest, the child actually has infection also in the brain. He has infection everywhere. And ultimately, if something is not done promptly, that child can die.
The best time to handle pneumonia is as early as possible before it gets complicated, and therefore you need a person who can recognize the signs and symptoms of pneumonia in order to address it appropriately. Once you see a child with a history of cough, catarrh, fever, difficulty in breathing, and signs of respiratory distress, respiratory difficulties, especially drawing in of the chest, it shows you that that child has significant pneumonia. So that child will require hospital attention.
Environmental factors that cause and help in the spread of pneumonia among vulnerable children need to be tackled.
Pneumonia is treatable, but it must be treated adequately, and it must be treated by those who know what they are doing. The main form of treatment for pneumonia is to use antibiotics, appropriate antibiotics. There are so many antibiotics that are not required for pneumonia. Some of them are also not effective. But in a good health center where you have doctors and those who have been taught on the proper management of pneumonia, they know the antibiotics to choose.
Vaccines to protect children from pneumonia are now available in Nigeria.
We can protect them by very simple measures that are available. Exclusive breastfeeding. Now, God in His kindness has provided breast milk as the first immunization for every child. The first milk that comes out of the mother is extremely rich. It has a special constituent that is meant to protect children from infections. And so every mother should endeavor to give their babies breast milk and nothing else for the first 6 months of life. That will help to build immunity in the babies. It will help keep the babies healthy and strong, and they are less likely to get infection, not just pneumonia, but many other infections.
Regular hand washing, it is so important, especially by caregivers, caregivers and care providers. It may seem simple that washing of the hand, regular washing of the hand, will prevent a disease as serious as pneumonia. The reason is that regular washing of the hand washes away germs. All these germs that we've been talking about, many of them may be lurking in the around, and somebody can also be transferring it one way or the other. So regular hand washing is an important aspect of the protection against pneumonia.
Food security. We know that malnutrition is a major cause of pneumonia. The policy of exclusive breastfeeding should be enforced, because children who are well fed right from day one have a higher resistance to developing infections. The exclusive breastfeeding rate in Nigeria has really dropped significantly, even though there are efforts to improve those statistics, but we still need to do a lot more to encourage mothers to exclusively breastfeed so that their children will be now well nourished.
Adequate nutrition is so important. A healthy, adequately well-fed child will hardly have pneumonia, especially very severe type of pneumonia. And this nutrition that I'm talking about also includes those micronutrients. You know, where we know what micronutrients are, but the ones that are actually we're really emphasizing include zinc and vitamin A, which in fact plays a major role in the prevention of pneumonia. Of course, we talked about smoking. avoidance of smoking, or either indoor smoke or adult smoking indoors, if we avoid it, because that would be passive smoking for the child. If we avoid it, and we do not do that in the presence of children, it will also lead to the prevention of pneumonia.
Protecting the environment. We talked about environment earlier. Making sure that there is no indoor pollution. Ensuring that there's nobody smoking inside the house where children are. That is very important.
These vaccines are only within the reach of a very few children in the urban centers. Majority of children in Nigeria are not vaccinated against this deadly disease. The Pediatric Association of Nigeria is leading the advocacy for the vaccines against pneumonia to be included in the National Immunization Program for children.
The most important is vaccination. In fact, vaccination, not just preventing only, is actually the most cost-effective way to prevent pneumonia from ever happening. And that's why even in our own environment, our government and other agencies, they emphasize vaccinating these children. And if you look at it, for instance in pneumonia, because of the certain germs that are also responsible, that may be a factor, again, vaccination or immunization against those germs become very, very important.
This is a clarion call to the Nigerian government to urgently provide the appropriate modalities for the immunization of Nigerian children against pneumonia. This is the right thing to do to save millions of children from the kind of trauma Sufiat and her mother are going through.
Vaccination has been proven to be the best tool to preserve lives of children across the world. And there are certain organisms certain germs that have been identified to cause more than half of the cases of pneumonia across the world. And those two germs are Streptococcus pneumoniae and Haemophilus influenza type B. And the good news is that there are vaccines that can prevent these two diseases. The vaccines are available. They are being used in developed countries. They are available in our country. However, unfortunately, as at now, they are not in the routine immunization program of the children of Nigeria. The government knows about these vaccines. The government knows that our children will benefit from these vaccines, and we are aware that they are planning to include those vaccines in the program. But as an association, the Pediatric Association of Nigeria is extremely concerned. Concerned because the clock is ticking, and in every 3 minutes, a child in this country is dying from pneumonia. So the children cannot wait. They need something to be done immediately.
Nippon now.